Hello, I'm Dr. Joanie Winstead. I am a board-eligible chiropractic neurologist. I graduated from the prestigious Palmer College of Chiropractic in Davenport, Iowa. I am a member of the Dr. Michael L. Johnson's Functional Neurology Group, which is comprised of over 500 doctors who consult on cases of chronically ill patients. I have in excess of 300 hours in neurology through the world-renowned Carrick Institute. I have over 100 hours of metabolic testing through Apex Energetics that include neurotransmitters in the brain, functional blood chemistry, functional endocrinology, and mastering the thyroid. I have been in private practice for 6 years in Carthage, Mississippi. Now, this video is about autoimmune disorders. And an autoimmune disorder is where the immune system is attacking a body part. There's rheumatoid arthritis, which is where your immune system is attacking your joints. There's Sjogren's syndrome, where your immune system is attacking the moisture-producing glands. There's lupus. This is where your immune system is attacking the skin, joints, kidneys, and other organs. There's scleroderma, where your immune system is attacking connective tissue. There's Hashimoto's thyroiditis, where your immune system is attacking your thyroid. There's Graves' disease, which is a hyperthyroid condition. There's MS, where their immune system is attacking the brain and the spinal cord. There's celiac disease, where the immune system is attacking the intestinal tract. There's Addison's disease, where it is attacking the adrenal glands. There's pernicious anemia, which has to do with red blood cells and B12. There's myasthenia gravis, where the immune system is attacking the muscles. There's Raynaud's syndrome, where the immune system is attacking the joints. There's type 1 diabetes, where the immune system is attacking the pancreas. Now, that's just a few among all the autoimmune disorders. So, like I said, there's a lot of different autoimmune conditions, and I'm here to tell you what makes us different from every other doctor you have seen is that we treat you metabolically and neurologically. So you are watching this DVD because you or someone you know or love is suffering from an autoimmune condition. It's where the immune system is attacking a particular part of the body. And I'm also here to tell you that we leave no stone unturned when it comes to the exact cause of your condition. People want to know, how do I treat autoimmune conditions successfully? Well, I treat them metabolically and neurologically. It's hand in hand. You have to do it together. So, what do we start with? Well, on the metabolic side, we start with a complete lab panel, complete blood work. And what do I mean by that? Well, I have people who come in all the time and tell me that their labs are normal. Well, folks, there is a normal broad range of labs, and then there's a functional lab range. For example, let's talk about TSH, which is the thyroid stimulating hormone. The lab values are 0.5 to 5.0. And the functional lab values are 1.8 to 3.0. So that's a lot narrower range. Okay, so back to what we want. We want a complete metabolic panel, not a basic panel. We want a complete blood chemistry with autodifferential, because we're looking at the red blood cells and the white blood cells. We want to look at a complete thyroid panel that includes TSH, free T3, free T4, and total T4, among others. And then we want to look at a lipid panel. We want to look at all those lab ranges and be as thorough as possible. We need to look at a sensitivity testing. There are certain food proteins that can affect your autoimmune condition, and we must know if you have any of these sensitivities. Some of the symptoms of these food sensitivities include bloating, frequent indigestion, chronic constipation, diarrhea, mouth ulcers, and vomiting often. And you don't know unless you run the test. But if you have an autoimmune condition, I can almost guarantee you that you are sensitive to one of the proteins that we check. We also need to check your adrenal glands. Your adrenal glands are your stress organs, and they sit right above your kidneys. This is measured with a salivary test, and it measures your cortisol levels at 8 a.m., noon, 4 p.m., and 10 p.m. And we have to run tests to check your immune system. We have a Th1 and Th2 system that should work together. When we have an autoimmune condition, usually we have one side that is more dominant than the other. And there are a couple of reasons for that, one being an active antigen, which can be a parasite, bacteria, virus, mold, yeast, foods, remember the food sensitivity testing, chemicals, and heavy metals. So we will check all of those. And the other is a dysregulation of the system, which we will check with some blood tests. We will also look at the inflammation, which is your CRP levels and the homocysteine. We look at everything, and then we treat those things nutritionally from the lab results. And then we treat the conditions metabolically. Your body needs two things to survive: fuel and activation. Fuel comes in two forms: glucose and oxygen. We will teach you some breathing techniques to increase your oxygen level. And glucose is from the food we eat. You must have a healthy diet, so we will also look at that. And some other things that we do in conjunction with breathing exercises to increase activation and to promote an increase in neurons or brain cells is unilateral adjusting. The right brain controls the left side and vice versa. If there's a decrease of firing on one side, I only want to stimulate that side of the brain. We may use auditory stimulation, which is listening to sound, different music. We may use visual stimulation. Visual stimulation is one of the most powerful stimulants to the brain. We may use olfactory stimulation, vibration stimulation, it stimulates the dorsal columns of the spine. And there are numerous other therapies that we will utilize depending on your individual exam findings. So with all of this, once we have run all the tests to determine the specific condition and the specific cause of the condition, we can successfully relieve some of your autoimmune condition symptoms. And I really don't care what it's called, we can give you some relief because we get to the cause of the problem. So ask yourself the following questions. Has your condition affected your family, your job, your relationship with others, or other activities? What has it cost you in time, money, happiness, sleep? Where do you see yourself in the next 1 to 3 years if this problem is not taken care of? And finally, what is it worth to you if you qualify for care and we're able to help you? And the reason I ask what is it worth to you is that I have patients who come in and say they're willing to do whatever it takes, but when the tests come back and they need to stay away from certain foods, they don't do it. Well, if you're not willing to make a commitment to do whatever it takes, don't waste your money or my time, because I cannot help you if you are not willing to help yourself. I'm not trying to be rude, but I'm very serious about helping people, and you must be willing to help yourself. I successfully treat these conditions every day, and right now I'm going to offer you 2 free visits. You can come in and we will review the paperwork and do a neurological exam. Your second visit is where I let you know if I can accept you for care and what that will require of you. So, with that being said, if you are interested, call my office at 601-267-3996 to set up the first of your 2 free visits. And I'm Dr. Joanie Winstead, and I want to thank you for watching this video. I look forward to helping you change your life.